Oh, thanks. All right, thank you very much. My name is Daniel Novak. I am the Director of Student Scholarly Activities here at the University of California, Riverside School of Medicine. And I would like to introduce you to our Health System Science Project, which is our longitudinal approach to undergraduate medical education, research education. This is our MD program's signature research project that students must complete before they graduate. The reason we're recording this video is we think it's really important to help prospective students and also our current students understand our curriculum and understand how to be successful in it and what our goals for that program are. I'm the primary instructor for this course, which is kind of wraps around the project. I have a background in social psychology research and research methods. And I think that it's really a great honor to be able to help share some of that knowledge and some of my experience with students, and also to connect them with clinical mentors across our school's health enterprise. Part of the reason this is so important, and this is a core feature of our school's curriculum, is that medical students really matter in research and scholarship. There's a 2015 meta-analysis that found that about 1 in 10 journal articles involve a medical student contributor providing important insights and services on projects. 30% of research projects conducted by med students do result in publications, and students who engage in research during med school are more likely to engage in research later as well. And less than 25% of med schools sampled in this study offered formal instruction on research. Other studies did find that about 40% of residency interviewers ask about research, and research experiences outside of school does correlate with match rates. And we think in particular that this matches up with our experience with program directors and other interviewers during residency programs asking about student research fairly often. So we think that having good projects that students have developed under their belt makes them much more marketable as residents, future residents, and also for other reasons that we'll discuss in a moment. But really, you might ask, why and who cares? Why do we go through all this effort of training physicians to be competent researchers? And I often get the question, I'm going to be a clinician and work with patients. Why should I bother with research? I'm never going to do this. I hate this. I never want to do this again. We see this is a very common sentiment on the internet, especially Reddit, where students do express this fairly freely. But medical students who engage in research and scholarship are better able to critique new research, or to see what is not and who is not represented by the research. They're better able to sense emerging gaps between what we know and what we need to know. They're better able to train research competent students when they become attendings. And they're able to participate in the great chain of knowledge production that connects people across the planet. I think that's really special. And also, to develop a strong CV for their future career. This is particularly important these days, where the graphs of student participation, student publication, and scholarly activities going into residency are showing an upward trend across all disciplines, not just the conventional radiology, ophthalmology, anesthesiology, dermatology, and specialty surgeries like plastics, neuro, and ortho, but also in every other discipline. We're starting to see the number of publications and scholarly activities increase, especially at high-level programs. So this is something we think is really important to help everybody be prepared to do. Increasingly, though, we're also starting to consider the importance of developing a researcher identity. So after working with hundreds of students, I've started to recognize some themes that I definitely see across the board. I hear students say things to me like, I'm not a researcher. I'm not that kind of person. I don't know what that is. I've never done that before. I never did that in undergrad. I don't even know where to start, is a thing I hear all the time. I've worked with mentors on their projects, but I've never led my own project. How would I start a project? These are things that are very common sentiments. But I've also heard from students, I've already got publications. I know how to do research. I'm good. I don't need to do this. Well, my question to them is, are you ready to be a PI? Are you truly ready to take on the full breadth of responsibilities for completing a project? Do you know how to start and lead projects from the ground up? Have you ever gone through that process, start to finish? And one thing that this makes me think about is an idea from Dorothy Holland, who's a famous anthropologist. In her book, Identity and Agency in Cultural Worlds, I thought this was a very powerful concept. She says, people tell others who they are, but even more important, they tell themselves and then try to act as though they are who they say they are. These self-understandings, especially those with strong emotional resonance for the teller, are what we refer to as identities. And in this continuous self-fashioning, identities are hard-won standpoints that, however dependent upon social support and however vulnerable to change, make at least a modicum of self-direction possible. And I think that that really helps us to understand how the idea of thinking about yourself as a researcher, having a positive researcher identity, can make a long-term impact in our students' careers, in the work that they do with our communities, with the work that they do with their patients, and the ways that they contribute to scientific knowledge. And those are things, I think, by focusing and thinking about a researcher identity, that can really be a powerful frame for designing our project and our goals for that. Our required research experience is called the Health System Science Project. It's a longitudinal project that focuses on potentially publishable research on health disparities in systems research. It provides a launch pad for students to develop confidence and competence in core research skills so that they're better able to conduct independent research in the future. I do want to note that this redesign of our program a couple of years ago was sponsored by funding from the Accelerating Change in Medical Education Innovation Grant Program, which was a competitive grant program that the AMA offered $20,000, which mostly went to faculty buyout. The AMA had no input, however, in the design, development perspectives or content of this course or of this project. So we're thankful for their support, but also that it was not at all part of the development of the actual project. But how do these things fit together? How does the HSSP help to build that research identity? Well, HSSP is that time to develop your researcher identity for our students. It's to discover what interests them in clinical research and create something of enduring value for themselves. And it's one of the only areas in med school where they aren't being told what to do and how to do it. This is something where they actually have a degree of autonomy and they can practice in a safe way that actually could potentially produce good quality research that might be valuable to others. And to kind of orient students to issues of health justice and health system science, this health system science project really helps to provide that focus for our students. You might also ask, what is health system science? Well, health system science is now thought of as the third leg of the stool of medical education, along with basic and clinical sciences. But the AMA defines it as the fundamental understanding of how care is delivered, how healthcare professionals work together to deliver that care, and how the health system can provide patient care and healthcare delivery. I think that's a very anodyne, very uncontroversial perspective, but I would say more than that, it's the study of the transformation of our society so that good health is placed within reach of every person. That means, for example, looking at issues more broadly of transportation, of education, of all sorts of socioeconomic indicators that might impact the ability of people to achieve good health and maintain their good health. The health system science more broadly includes a whole range of other topics, including systems thinking, value-based care, patient safety, patient education, teamwork and team science, but also areas like clinical informatics. Areas that we're pushing to kind of also include are things like justice, equity, and anti-racism, advocacy and community-based action, structural and social determinants of health, law and ethics, policy and economics, medical humanities, and medical education. So we think that these are part of a better understanding of health system science that can be built long-term. And it's a growing field in medicine and scholarship, encompasses a wider array of possible projects and scholarship opportunities, and allows students to conduct scholarship in and beyond their clinical sites. This provides options for students who cannot conduct research or scholarship at their clinical sites as well. Ultimately, we anticipate that the benefits of the Health System Science Project include that it integrates really nicely with the master adaptive learner and lifelong learner approaches that we really think medicine is orienting towards, and that's something that we want to support students understanding from the very beginning. It creates more opportunities for students to express their interests and contribute to scholarship in diverse ways, and to learn advanced teamwork skills, because it is a team project from the start. Now, let me tell you a little bit about the thread details, about some of the things that we designed into this program. Again, why we approach research this way? Well, students do not typically learn to conduct research in such a structured way. Substantial variance in the skills that students bring with them into med schools indicates that this is probably something we need to do. Students who learn to conduct research in this way will produce, ideally, research that has higher quality, more enduring value to the scientific and local communities, be better able to critique the research that they encounter in the rest of their career, learn to work in teams to accomplish these goals in the 3-year program, be more attractive to future residency programs, and be better able to mentor and support the next generation of physician scientists. So in concert with our broader goals related to medical student research, we think that our program design helps to really support those specific dimensions. And more specifically, our goals are that in successfully completing the project, students will promote health justice and patient-centered care in the community by understanding how medical practice and medical care impacts our populations. They will contribute important scientific knowledge to the community and beyond, and they will develop their own expertise in a facet of scholarship that will serve them and their patients in the long run. At a finer level of detail, our program objectives are to describe the process and purpose of each phase of the research cycle, develop a command of the scholarly literature around their chosen topic, demonstrate skills in a chosen qualitative, quantitative, or other research paradigm, identify how their subject of study fits into the activity of the broader health system, analyze and synthesize data to inform features of medical practice, and provide valuable knowledge to their community partners and preceptors. To accomplish this, the way we sat down and structured this program focuses on what I jokingly call the 10-step dance of research. That is, in order to leave our program fully prepared to engage in more in-depth and higher quality research in residency and beyond, we want students to observe need for new knowledge, review contemporary scholarship, formulate a research question, select appropriate methods and research design, at least understand, if not obtain, human subjects clearance for their project, collect data, analyze that data, synthesize that into findings, provide implications for research or practice, as well as limitations of their study, and also provide a final public product, public presentation of their final product as well. So we think that in concluding these 10 steps over the course of 3 years, our students are going to be better prepared to go out there and engage in research beyond medical school. Here's the curriculum timeline. In year 1, the students engage in observation and ideation and team formation. So thinking about what they want to do before they really commit to a long-term project, making sure that there's a need in there. And that leads into reviewing contemporary scholarship and formulating a research question in spring of the first year. And in year 2, developing a research design and starting their data analysis. In the end of year 2, concluding that data analysis and beginning writing their findings and doing a public presentation. I'll talk more about that in a moment. In year 3, they engage in synthesis, concluding of their writing, implications for research or practice, and their public presentation of the final product at Dean's Research Day as a poster, and a final written paper and abstract that are part of the assignments. You can see a layout really here of how this is expected. So team statement of purpose, we have literature reviews, research design, and the final poster and PowerPoint presentations at their respective positions in years 1, 2, and 3. One change we've made to our program to make it not only more doable, but to stay focused on what we really want students to learn about the research process is the integration of Trinetics and health informatics into our curriculum. Our curriculum leverages the Trinetics platform to help provide students with a meaningful, self-directed, and authentic research experience. It is a powerful clinical data set with 120 million patient records and a very user-friendly interface that provides students with calculations of measures of association, treatment pathways and outcomes, Cox proportional hazards models, other approaches and common statistical techniques that can be really useful for our students to develop their awareness and knowledge of research practices and methods. It's a great way to also learn about clinical informatics, which is an emerging field that is part of the health system sciences, but also going to be, I think, a huge role going forward, especially with the emergence of AI and other similar technologies. And hundreds of publications are produced based on the Trinetics data set each year on trends in real clinical data. We also think that this is a great way to use big data for health justice. We have a number of different students who have looked at projects related to health justice issues using this platform, to disparities, to differences in treatment and differences in assessment that might occur as a result of some of the health justice issues that we face in the United States. You might ask, though, what is Trinetics? I gave a little bit of detail a moment ago, but as I said, it's a very user-friendly platform that in a lot of ways scaffolds the data analysis process for our students very nicely. It's an electronic health record mining system that pulls data from more than 70 electronic health records and healthcare organizations across the US, including our partners at UCI and UCSD, but also USC, Johns Hopkins, Virginia Tech Carilion, University of Iowa, University of Alabama, University of Texas, plus more countries globally, including Brazil, Israel, Russia, the UK, France. Health systems across the world are contributing data into the platform as well. It includes structured data such as demographics, age, sex, language, racial categories, and marital status, diagnostics through ICD-10 codes, procedures through CPT and also ICD-10 procedural codes, drugs, labs, genomics, visits, all sorts of really great structured data that we can use to examine trends in healthcare. One nice feature for our students is that there's no HIPAA information included anywhere in the platform. It is all non-human subjects research data, meaning that students do not have to go through a lengthy approval process in order to conduct their projects. They can work on them at any time. The average age of patient records is roughly 7 years, meaning we get a pretty good longitudinal snapshot of people's health. Some records run for as long as 20 years. So we actually get a very, very long view of people's health, which is something that is very difficult to do with randomized controlled trials or other kinds of observational studies where people disappear and unenroll from the study or stop responding and things like that. Because the data come directly from their health records, as long as they're still going back to those hospital systems, their data is still being collected. Also, data is refreshed weekly or monthly, depending on the organization, meaning that the data are fairly up to date with people's need or with people's treatment, meaning that it is possible to look at moving trends as well. We'll look really quickly just to show you how to think about this. There's a global data set with now closer to 170 million patients, a US data network nested within that includes 120 or so million of that 170 million patients. There's a UC collaborative network that we're part of that shares data between UCI, UCSD, and UCR. And finally, UCR Health itself, we can look at our own data using this. However, we do request that folks request this access to this in order to do projects that are directly related to the needs of UCR Health. So one thing to note is geography is obscured beyond the UCR Health level, meaning we don't know exactly where these folks live. We cannot look at things by zip code. We can't look at it, even though we know how important this is generally to people's health. We can't specifically look at it in this data set. Trinetics is cohort-based research, meaning we don't have individual level data to use for the purposes of our projects. Things in terms of cohorts or groups that share common characteristics, demographic or medical characteristics. And studies are retrospective, but cohort comparisons can be used to create natural experiments using real-world data. It also includes built-in propensity score matching, which can help to adjust for confounding variables. It's a very complex and interesting statistical methodology for helping to avoid biases built into individual groups based on natural grouping patterns. The cohort builder and the interface is very easy to use. It's searchable. You can really easily put together your queries once you kind of know how these how it thinks and know how it works. And I think that it's actually been really great to see students take this and run with it and find innovative ways to use the cohort builder and the platform to do new kinds of research. As I said earlier, it has a number of different kinds of analytic tools in it that our students can leverage to conduct their research, including, as I said, treatment pathways and time on treatment, comparing outcomes, and competing risks, among other factors. So in conclusion, we've pivoted to the use of Trinetics for this project. Why? Because it's an opportunity for medical students to develop their knowledge of medical sciences, and they have a lot to learn about medicine in order even to make use of this platform. I routinely have students where I talk to them and I'm like, well, what's the relationship between these two things? Why are you looking for a correlation or a predictive, or not predictive, but an association between these two things? And they have to go back and really, really learn about the physiology, about the clinical medicine, relating these two factors before they can even begin to run meaningful statistical analyses. And that's a feature of self-directed learning, right? That's what residency programs want to see and what directors want to see, that they can practice these master adaptive learning skills by digging deep into one area and really understanding it. And that will help them form a pathway for future research where they will get engaged in that way. Finally, we come to some of our deliverables. This includes values, rubrics, and grading that we have looking forward. This is a sample of generally how our project deliverables are broken out, including the literature reviews and the project proposal and sign-off in May of year 1, the research design and PowerPoint presentation of their research project in year 2, and the science poster and final project write-up in year 3. So we think that this gives students enough time to really think and work on each component across the 3 years. And we also have a series of rubrics we've designed to make sure that we're emphasizing the right and most important components of each of these assignments. You can see here we've got a rubric for our literature review that emphasizes using a research framework, identifying a compelling research gap, structuring their review in a comprehensible way, developing synthesis of their studies and use of citations. Our research designs are focused on making sure that the composition of a research question makes sense according to things like the PICO or other frameworks for analyzing research questions. That the chosen methodology is actually appropriate for this, that if, for example, we're using Trinetics, that it's one that Trinetics can answer well with good quality results, that that's likely to be feasible, that it's valid and reliable, and that the ethical considerations are of both completing the project and trying to complete the project are considered well. Our research presentation similarly looks at project goals, values to the science of the community, summary of relevant literature and data collection, analysis strategy, and response to questions and feedback from the faculty. And our poster looks at the scientific context, findings, but also an opportunity for students to think about visual communication, their oral presentations, and discussions with judges, which are things you really only can experience properly when you're doing a live presentation with a poster or with PowerPoints. Our final project write-up is now more aligned with creating a study that would be publishable in a lot of different groups, even if students never go on to publish it. But it's the story of the project and research question, their methods, analysis and synthesis, limitations in future research, but also we ask them to think about what is the value of their study to the community. So that's it for now. I just wanted to give this quick overview of our curriculum to help you get a sense for what some of the important features of our curriculum are at the UCR School of Medicine in our Health System Science project and our research curriculum. And I want to thank you very much. Please feel free to contact me if you have any questions. You're always welcome to come and schedule some time with me or email me, and I'll send you the link to my booking calendar. Thank you very much. And all right, have a great day.